welcome to Sex and Stuff. I'm Nola, and today I have a special guest. This is my special guest, Annie. Annie, what are we doing today?
Today, Nola and I are going to be going through some of the most common STD myths, and we're going to tell you whether those are true or false.
So let's get started. Question number 1. If my partner has an STD, you can tell by looking at them.
That is false.
Correct, that is false. The only way that you know if you have an STD or not is by getting tested.
And how often should I be getting tested?
Every 3 to 6 months. Question number 2. A person can have an STD and not know it.
That is true.
That is absolutely true. The most common symptom with STDs are no symptoms. So most people can have an STD and not know it. So again, you need to be getting tested every 3 to 6 months if you're having multiple partners or having unprotected sex. Question number 3. You can get an STD from oral or anal sex.
That is true.
That's absolutely true. Any type of sex you have, you can get an STD, whether it's unprotected. So if you're engaging in oral sex with a male, use a condom. If you're engaging in oral sex with a female, use a dental dam. If you're having anal sex, use a condom. If you're having vaginal sex, use a condom. Question number 4. Once you've had an STD, there's no chance of getting it again.
That is false.
That is absolutely false. You may take antibiotics for STDs such as gonorrhea, chlamydia, or syphilis. You can always get them again. Some STDs like genital herpes, you will have your whole entire life. Question 5. Most STDs will go away on their own without treatment if I wait long enough.
That is false.
That is absolutely false. If you have an STD, such as gonorrhea, chlamydia, or syphilis, that need a bacteria, that are bacteria STDs, and you need an antibiotic to cure them, you need to cure them or they won't go away. And some viral ones will never go away.
And that's important to get tested because if you don't treat them and you wait for them to go away on their own, they won't, and that could lead to serious health complications.
That's right, it can lead to serious health complications. So you need to be getting tested and treated. Question number 6. If I'm checked, I'm STD free, my partner doesn't need to be getting checked.
That is false.
That is absolutely false. Your partner still may have an STD and not know it because they don't have any signs or symptoms. So your most important thing is to be getting tested. And your partner needs to be getting tested as well. Question number 7. I can get an STD from a toilet, bedding, swimming pools, or touching objects that someone has touched with that has an STD.
That is false.
That's absolutely false. There is no evidence to support this. So the only way that we know we can get an STD is coming in contact with someone's vaginal fluid, semen, even through pre-ejaculation. So any type of sex you're engaging in, oral, anal, or vaginal, you need to be using protection. Okay? All right, question number 8. I've only had one sexual partner, so I can't get an STD.
That is false.
That is false. So think about this. If your partner has had other partners before you, they can absolutely have an STD and not know it. Okay? So yes, you can definitely get an STD your first time having sex. Question number 9. I don't need to use a condom because I'm on birth control.
That is false.
That is definitely false. Birth control does exactly what it says. It protects you from getting pregnant. So you absolutely need to be using a condom, okay? Because you can still get STDs even if you're on birth control. Question 10. If my partner withdraws before ejaculation, I won't get an STD.
That is false.
And why is that false, Annie?
Because pre-ejaculation can still contain an STD.
That is right. So pre-ejaculation can still contain an STD, so you still can get an STD. So again, what's your best bet of always using?
Protection.
Protection, okay? Question 11. I can only get herpes if my partner has an outbreak.
That is false.
That is definitely false, okay? Sometimes that virus, genital herpes virus, sheds in vaginal fluid and semen even when they don't have an outbreak. So you can still get genital herpes that way. Question 12. Only people who've had a lot of sexual partners can get an STD.
That is false.
That is absolutely false. It doesn't matter how many sexual partners you've had. You may have 1, you may have 5, you may have had 20. But if you're having unprotected sex and the people that you are having sex with may have an STD, you absolutely have a chance of getting an STD. Last question, question 13. Human papillomavirus, or HPV, is the most common STD in the United States.
That is true.
That is true. About 90% of the population who has unprotected sex has the chance of getting HPV. So 90% of this population has HPV. Well, that is all the time we have for today. Thanks for being a great guest, Annie.
Thank you.
Thanks, everyone.
Bye, everyone.